you're by yourself and just need somebody to talk to run through a case and make sure that you're not missing anything big. I've done that with good success. To like, there's not enough hands and you just need somebody to walk you down from a crisis scenario or look at getting resources into your community. That's also what it's there for. I found it, like RTVS in general, to be a super helpful thing. Like new to practice, I also think it'd be helpful for everybody because it seems like it's for those confidence gap kind of cases where you just feel like you want to run it by somebody, make sure you're not missing anything, or it's something that's legitimately just intimidating due to lack of resources or lack of reps. Lots of times in rural BC, I think the story is like, I haven't intubated in 5 years. And so to have a checklist and most up-to-date information from somebody who does it a lot more often is a really useful resource. I just also like to say that the providers for RTVS seem to be like universally really keen to help, all very kind of understanding as to what you might be experiencing in rural, knowing like the logistics with transport, the logistics with, you might not have positive pressure ventilation for your neonate, and in Gold River we didn't. So, versus talking to accepting physicians at tertiary hospitals, that hasn't always been my experience of that rural lens and support. So from an advocacy perspective, from a help when you need it perspective, they seem to be like, really keen to help and really quite knowledgeable about the challenges of rural, which is kind of also invaluable. So can't say enough good things about RTVS.
You're going to get really good support and makes it more doable and less scary. There's nothing scarier than being alone and trying to make all these decisions, especially, family medicine. You just get a broad scope. You're not emergency doc. You're not you're not an obstetrician, but you get all those things, right? We had a cord prolapse at 26 weeks. And I was like, I can do a delivery, but when was the last time you seen a 26-week cord prolapse walk in, and there's nobody to take you, and so having that support with MaBAL and all those things are helpful, because you just can't remember it all. Like, you've read these things before, but can you pull it out in the moment? It's really tough.
Whenever you have a significant case, a challenging case, a case where you just wish you had a second opinion, you have a second opinion that's happy to give it. They want to be here and they want to be doing what they're doing, which makes it so much more accessible. And I think the more you use it, the more you want to keep using it. It's almost addicting how helpful it is, right? So I would say use it every opportunity you get. And if you're unsure, use it the first time and you'll be sure.